Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned local facility. Our goal in this program is to bring you information about healthcare issues that are relevant to you, your family, and friends. So I hope you'll stay tuned. I've got a really exciting guest on the show today. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Judy Gauthier. She's a registered nurse that works in the Cardiovascular Center at KRMC. Thanks for being on the show, Judy.
Thank you for having me.
So February is Heart Month, and obviously, so that's an important month for everybody, not just your Valentines, because even though we celebrate Valentine's Day, we celebrate heart overall for it too. So before we talk about though, I want people to get to know you a little bit better. So how long have you and your husband Roger lived in Kingman, in the Kingman area?
We've been here 11 years.
Wow.
And all 11 years I've been here at KRMC.
Okay.
And every minute of it's been great.
Wonderful. I know you're definitely a pro KRMC person.
Oh,
I know
yeah.
that. And before Kingman, where did you guys live before?
Pahrump, Nevada.
Oh.
Right outside of Las Vegas. We
Okay.
ran a small little clinic, and we took care of everything. There were no hospitals around. Everything had to be flown into Vegas. We got quite a well balance of experience with
Wow.
trauma, hearts, delivering babies, everything up
Yeah,
there.
because Roger's in healthcare too.
Yes,
He does
respiratory therapy.
Okay, very good. Well, and before then, where were you born and raised?
Pennsylvania.
Ah,
Pennsylvania, went into the military and ended up in Colorado for a few years, Boulder Community Hospital
Okay.
in Boulder, Colorado, that originally sent me to nursing school and started my whole career.
oh, very good. So you've been doing nursing for a long time.
Oh, Jamie. Yeah.
That's
I
okay,
think
you
I'm
don't-
on, yeah. 20 years?
Wow,
Yes.
very
Mhm.
good. And heart pretty much the whole time?
I
or-
did emergency room,
Okay.
ICU, pediatrics, and the last 12 years have been cardiac cath lab.
Okay. So now I'm trying to think when we started the cath lab here at KRMC. Was it already here when you started?
Oh, yeah.
The first one?
Yeah, I was here in the old lab in 2000, and that's when we introduced our interventional program.
Okay.
Before that, we would do a diagnostic on a patient having chest pain or whatever. If they were found to have a blockage in the heart, in those days we had to fly them to either Phoenix or Las Vegas
Oh, wow.
for the intervention to have the stent put in.
I didn't
Yes.
realize that.
And it was, it was hard, especially the elderly, the senior citizens. That's a lot to require, going to another, driving 3 hours away, nighttime driving, being away from, family
and friends,
support,
yeah.
and your significant other spends 5-6 days in the hospital.
Wow.
So this program has been wonderful that we have started doing the interventional program. We're able to keep everybody here. And of course, now we can do our open hearts here
Right.
too.
Yeah, that's
And
just
that
amazing.
it has been phenomenal for
Well,
this
it's
community.
such a gift, really. I consider it a gift to the
It is.
community because, like you said, not only is it the trauma of the patient, flying them, and the expense, obviously, even with insurance, a lot of times it doesn't all get covered. It's huge bills there. But then for the family to have to drive and have to go so far, like you said.
Absolutely.
And you always, I think, heal better when you've got your family with you.
Close to home.
Yeah, and when you're sick and then follow-up appointments and everything, I mean, it just, so to be able to keep that here at home, it's a huge difference.
It is. It's been a great success for the community.
Well, and we have wonderful staff. I mean, both the nursing staff, of course, like yourself and Claire and that whole team are incredible. And then the docs. I mean, we've just got some amazing physicians.
It
We got
is.
Dr. Bakari, of course, who helped start the cardio.
He has saved a
this
lot
cath
of
lab.
lives in this community. Yes,
Yes,
he's
he-
been here, oh boy, I want to say close to 30 years.
I think so.
He's
Like
been
we
here.
had awards for him last summer at our picnic, and I think 30 was the year they talked about
Yeah,
that.
he brought the cath lab to
Right,
this town.
that's what I was going to say. He's the one that was really the pusher to get that going.
And he did the intervention. He was one of the first ones to start the coronary interventions here.
Great. And then now, of course, when we had Dr. Dunning and Dr. Sadeh, we've added them to the team, and then, of course, Dr. Montero,
Oh,
our
yeah.
open heart. So what a team we have now
It
of
is.
incredible cardiologists and interventional cardiologists that can do all of that.
We're doing stuff the big cities,
Right.
a lot of stuff they don't even do.
Yeah.
We've had, Dr. Dunning has brought a whole new level of treatment to the cath lab. We're doing a lot of peripherals, people that had chronic occlusions in their legs, where they had not had circulation or good circulation. They've had poor circulation for years. He's going in and opening those up, and these people were getting tremendous results. You know, these people are starting to feel, you know, like one lady described it, my legs woke up.
Oh.
My legs have woke up. She's able to walk to her mailbox and come back, and this, you know, it enables people to be independent, stay at home, stay healthy.
Well, and I would think when you don't have circulation, then you're very prone to having to have amputations and things like that.
If you hurt yourself, you don't heal. You know, blood is what brings all the healing.
Right.
So, so we've had a great success.
That's awesome.
And having Dr. Dunning here has been wonderful. He's a great guy, great to work with.
Yeah, and then, of course, Dr. Saday's on that team as well, and he's awesome.
He has been here a long time. In fact, I think he and I came around the same time.
Oh, wow.
So he's also been here 11 years, or probably a little longer, and he is wonderful too. He is, his bedside manner is phenomenal. He deeply cares about his patients, and he's very dedicated to our heart program and to the hospital and the community.
Well, and, you know, one of the things I always like to tell people, our website, the hospital website, which is azkrmc.com, people can go there and look under Find a Physician, and then they go by their name or by their specialty. They can look them up there, and we've got their pictures, gives all of their educational background and all that. So if they're kind of concerned, they're I probably need to get some work done, but I don't know. You know, we hear that all the time. We're in Kingman, really? They just need to go and look at the background of these doctors, and they can rest assured these aren't just little guys that we, you know,
these guys all have a lot of experience under their belts. We have people walk in the front door and they've just like moved here from somewhere, and they need a recommendation. And what we'll do is write down the phone number for everybody.
Right.
And we say, call and talk to the office staff. Call and take your pick. And we tell them, Dr. Al-Khatib's fabulous. Dr. Sadeh's fabulous.
Right.
You know, they're all, Dr. Bakari, Dr. Dunning, they're all wonderful.
Right.
There isn't any of them that I wouldn't trust with my family or with myself.
Well, and that says a lot right there.
Oh, yeah.
You know, because personal testimony is huge. But if you trust them with your own life or your family's life, then that makes a big difference. And I think one of the things that we've talked about, too, being able to have one-stop shop is what I call it in our cath lab. Because, like you were talking about, it used to be, and there are still places in town sometimes where you will go in and have the angiogram done, but then if they find the blockage, they have to sew you up and bring you over to KRMC, or they send you out. And then you have to go through that all over again.
Yes.
And that's hard, not only because you've got the double vein issue that you've had to go through that, and then you've got the dye injected into your body again.
Absolutely.
So that's hard on your kidneys.
If you read the consent, your risks on the consent are kidney failure, dissection, that's the artery ripping open, and death. Now, I don't know why anybody would want to take those risks twice.
Yeah, exactly.
You know,
when you can just do it one time.
Even in Pennsylvania, they tried that with my mom at the hospital she was at. They said, we'll leave the sheath in and transport her to another hospital. And I said, oh, no, you will not.
Yeah.
Absolutely not.
Yeah. Let's just do it once and be done with it.
One time.
You know, and that is, like we're saying, what's so great here at our cardiovascular center is they're going to go in, they'll do the angiogram, they find the blockage, they can fix it right there. And you're done. I mean, not done. You got healing, obviously.
Yeah.
But I mean, you know.
And stay compliant on your medications. And then we have the cardiac rehab program they can go to afterwards. Phenomenal program. Wonderful program.
Well, I've often thought that it's how scary. You've had a heart attack, you have a heart issue, then it's kind of scary to think about exercising again. You're not wanting to strain that heart. But
and it does. That's what people are afraid of, that they're going to, and they get in with a group of their peers and they realize, I don't have to quit smoking alone. I've got friends, I've got all this education. I'm going to change my dietary style. I can't use lard and shortening anymore. I'm going to switch to olive oil, and they have a group, and Claire and I went and spoke at a group of cardiac rehab patients. They had all been our patients 6 months earlier.
Yeah.
And these people were very sick when they were with us. It was amazing, the transformation I saw in these people. And they all said, nope, I don't smoke anymore. I'm out exercising 20 minutes a day, walking, and it was like, gosh, this is great.
So you can turn your life around.
You can turn, no matter what age you are, you can turn your life around.
By changing your lifestyle, your health habits.
Absolutely. Taking charge.
Right.
Taking charge of yourself.
So that's cool. And of course, the cardiovascular center is beautiful too.
It is gorgeous. It is
Because
gorgeous.
when I first started here, we just had the one old cath lab, and I think that last year they said we did like 2,000 procedures in that one cath
We did.
lab. That's
We did.
unheard of.
We did 2,000.
And so now the new cardiovascular center, we have 2 cath labs, plus it's shelled that at some point in time, someday, we
For
could
three.
expand
Third
the
room.
third one. Yeah.
And it's getting there.
Yeah.
It's getting there really
I bet
quick.
with all these great new docs, and I can see why we're going to probably need to keep
And
growing.
we've been doing 10 to 14 cases a day.
Wow.
So yeah, we'll get the third room up and running, and that's great on the patients too. They're usually NPO at midnight for the procedure, nothing to eat or drink.
Right.
So you want to get done the next morning. You
Right.
don't want to have to wait till 2 o'clock. Then
Right.
we're getting them through pretty quick
That's
with
awesome.
wonderful results.
Yeah,
really good
that's-
results.
Yeah, and that's like an amazing thing. Well, my father-in-law was in not too long ago,
Oh,
the same kind of thing.
yeah.
And, it's amazing how once you get that blockage out of there and cleared up, just the color, oh, I forgot you used to be that color. You haven't always looked pasty. No.
That's true.
That whole circulation.
And that, as I recall, was after hours. So we're available 24/7,
Right.
7 days a week.
Yes.
We always have a call team available, and we are here within 20 minutes of that phone call coming in to get here.
That's
We're
right,
here
I
and
forgot.
set up.
I forgot. There's almost a requirement now, isn't it? For
Yes, Medicare requirement is 90-minute door-to-balloon time, meaning as soon as they hit our ER complaining of chest pain, showing symptoms of a heart attack or any coronary event, we have 90 minutes that we have to be in there and have that balloon across the lesion, some people call it blockage, disease, and opened up.
Wow.
90 minutes is Medicare's requirement.
Now so when you say balloon, is that the stent? What is the balloon?
The balloon, we can go in and post-dilate, pre-dilate, if you will. I'm sorry.
That's okay.
Before, when the doctor finds the lesion, we can go in with the balloon and open it up a little and make way for the stent delivery to come
Oh,
in. The
okay.
stent's also on a balloon.
Okay.
And you inflate the balloon.
That kind of clears the way for it.
Yeah, the stent on the sticks to the arterial walls, and when you deflate the balloon, you can bring it out. So you can have, a lot of the doctors do like to pre-dilate a lesion ahead of time before a stent goes in.
Okay.
And it's less trauma to the artery.
Very good. Well, I know we've got some fun stuff coming up in February. We're going to talk about that right after these messages, so stay tuned because we've got some exciting things to tell you about. We'll be right back. Welcome back to Your Health Matters. My guest today is Judy Gauthier. She's a registered nurse at the KRMC Cardiac Cath Lab. It's been fun talking to you, Judy.
Thank you. It's been fun being here.
Well, and I always learn so much from this, all of my guests. And we were talking before the break about the different stents and the balloons and all of that. And people now have an opportunity in February to come and learn more kind of for themselves ahead of time.
Absolutely.
So we're doing a big open house for the whole cardiovascular center. The whole team is going to be there. And it's on Valentine's Day. How perfect, right?
February's Heart Month.
Right, and so it's on Valentine's Day, February 14th. It's a Tuesday, and it's from 1 to 4
Yes.
in the Cardiovascular Center. And I don't know how anybody could miss it, because you just have to drive down Stockton Hill before you get to O'Reilly's there, and there's the big cardiovascular sticking out
beautiful.
there. It's a beautiful facility, that big copper front.
Yeah, we start at 1 o'clock, and we're going to have, I believe, like 20 different reps from medical
Wow.
supply companies. So these guys are great. They will bring videotapes. You'll be able to actually see a stent being deployed.
cool.
You know, they have the video. You'll see a balloon being inflated. All our pacemaker reps will be there from St. Jude Medical, from Boston Scientific. You can handle a pacemaker, look at
Kind
a
of feel it,
BIV.
pick
If
it
you
up
have a
and feel it.
BIV in, you'll be able to see what it is. You can ask them questions. How long does this last? Do I need this replaced? These guys are there to educate.
Awesome.
They are there to answer your questions and to educate. If you're on Effient, Plavix, talk to these people.
Okay.
They are a world of knowledge. They're
That's
great.
wonderful.
And it's going to be a really fun event. All the nurses and the techs including the echocardiogram staff. We will bake lots of cookies. Chocolate's always the most famous. And there'll be plenty to eat for the public. We're going to have sandwiches catered by our own cafeteria, tea, punch, water. It's a fun day of education and snacking. It really is. It's a great day.
You're not looking for more patients. No.
No. We want the patients, the people we've taken care of. Come on in.
Yeah.
And if you are scheduled for
A procedure
in the future, come on in and talk to us. We'll be glad.
If you think about it, almost everybody at some point in time is either, if not themselves, a loved one. Like myself, I have 2 family members that have had procedures done there now. And so it's better to know ahead of time what what the processes are going to be, to see the facility, and kind of helps put your own fears, allay them a little bit.
Absolutely.
Meet the people, meet the staff.
A lot of people with pacemakers still think they can't go near a microwave oven.
Right.
If you have a microwave that's dated before 1975, get rid of it. That was just the old microwaves.
Okay.
But, a lot of questions like that. Put your fears at ease. Come on in and talk to these people.
Well, probably too, a lot of people, especially if they come in under emergency, then they were so sick when they came in and then so groggy afterwards and everything else. They probably didn't even think about the questions they might have at the time.
Oh, yes.
So now would be a good time to come back and re-ask those questions.
Yeah, you can. We'll even have it like actual stents you can hold in your hands and look at.
This is what's in me.
And that's all it is. You can go through the airport security. It's not going to pick it up. So, yeah, it'll be a fun afternoon. We want the public there.
Okay.
We want you to come on in and tour our facility and
When I
sit
think
down
the whole
and talk to
team's
all of us.
planning there. So, I mean, in the Cath lab, the angiogram, is that right when that's the diagnostic side, and echocardiograms, and when they
the
first
echo,
start.
they do the ultrasound.
Okay, and
they can do
that's-
it invasive or non-invasive.
Okay, and that's how they first figure out you got a problem.
There's lots of different ways to figure out.
Okay.
Sometimes the doctors want to do a stress test if you're having the symptoms to see if it's actually coming from your heart.
Okay.
And yes, echo plays a very vital role in
Okay.
diagnosing valve disease, low ejection fraction if your main
Your
pump of your
heart's
heart
not
is not
working.
working well, and if you're in AFib, that's where they go down your throat and take a look at the heart, make sure there's no clots forming.
Okay.
They play a very vital role in diagnosing and taking care of cardiac patients.
And that's
Come
that
on in
whole
and talk to
team.
them. They set up a
Okay.
booth too. They're
And
great.
and rehab's going to be there too.
Cardiac
so
rehab will be
from-
there.
Kind of from beginning through the
The
end.
whole entire process.
Right.
You can
And-
talk to everybody.
I think Dr. Montero, the open heart
Yes.
surgeons team, is going to be
Yes,
there.
and
so.
I have asked them to get us a video of an open heart.
Ooh.
So Matt's working on that right now. We'll see what
Okay.
he comes up with.
That would be
And I
cool.
don't know if everybody can want to see that, but
Yeah.
I think it'd be interesting.
Yeah, I
think
do too.
It's great.
Right.
I'm sure a lot of people have questions and want to see that.
Well, and like what we were saying earlier, the unknown is our biggest fear. And if you know what to expect and you know what is going to be coming down the pike, it's not as scary. And for the family too, they are going to be able to deal better with the situation if they are
Absolutely.
prepared ahead of time. And you said you got free food. Can't hardly pass that up.
Homemade cookies.
Homemade cookies. Oh my goodness. So that's February 14th from 1 to 4 in
Absolutely.
the Cardiovascular Center. I think they can call Scott Kern at 681-8656 if they have more questions about that.
Okay.
I think you guys will probably be at the Senior Health Fair in February too. You guys usually have a
Yes.
table there
Yes.
to help educate again. It's
Once again, we
education.
like to show up and we'll be happy to answer any questions.
Okay.
That whether it's about the medications you're on or, what you can show us your stent card. We can tell you where exactly your stent is and how big it is.
Oh,
we
that's
can help
cool.
you out. Oh, yeah.
The other thing I know, we've talked personally on the other level of you get repeats sometimes that people come in and have to have it done again.
Yeah.
What do you think is the reason for that?
There's a lot of different reasons for that, Jamie. One of them can be some of us are just born with
Too much cholesterol or something?
some people just get the luck of the draw. You're going to
Right.
have bad heart disease. We got risk factors we can control and risk factors we cannot control.
Right.
We can't control who our parents were. We had no control. We cannot control if we're male or female. Unfortunately, men still have a larger amount of heart disease than women. The risk factors we can control, cigarette smoking. That's a unfortunately, that's a big one. That plays havoc on your vessels, not only your heart, your legs, and your kidneys. We can control our weight, our salt intake, and lifestyle, just our lifestyle.
Yeah.
And another one is medication compliance. If the doctor put you on medication for hypertension, high blood pressure, or diabetes, those are two big ones. Stay compliant. Take care of it. I can't stress that enough.
So
Stay on your medications, manage your high blood pressure, manage your diabetes.
Right.
Blood pressure, high blood pressure, your heart's working way harder than it should normally have to. And if you're not managing that, you're doing your heart a lot of stress, a lot.
Okay.
Another big one is after they come in and get a stent the first time around, we usually put them on a medication, Plavix or Effient. Now you see these lawyer commercials out there saying if you're on Plavix, you could run a risk of a stroke. A lot of times we get patients in, and we just had one not too long ago, and this person came in about 2 in the morning, very, very sick. We almost lost this patient. And the spouse told us the patient had seen that lawyer commercial a couple weeks earlier, panicked and stopped her Plavix.
Wow.
And she had another big heart attack.
Wow.
And I can't stress it enough. You know, they may say you run a risk of a stroke. That risk is maybe 2%. Your risk of another heart attack, you go off that medication, is 100%.
Whew.
So
That's kinda
elective
like-
procedures is another one. People choose to maybe have a knee replacement or a dental procedure, and somebody may advise go off all your blood thinners, go off your Plavix.
Yeah.
Once again, at 2 in the morning, we see them in our lab.
Wow.
So always talk to your cardiologist beforehand.
Okay.
If another doctor advises you to go off it for a couple days, please, please, please talk to your cardiologist first.
Okay.
He may tell you to wait a month or two. And it is for your own good. And
Right.
that's where we see a lot of repeat offenders, the
Interesting.
non-compliance with the medication or the fear, once again,
Yeah.
watching these commercials that
Yeah.
put the fear of death right in you
Right.
immediately.
Yeah.
So I can't stress that enough,
Okay.
to stay on your Plavix and Effient.
And again, those are the kind of questions and issues that if people come to that open house, they'll have healthcare professionals like yourself there that can answer those one-to-one questions. If you would.
Absolutely.
Yeah.
And anytime anybody has a question, whether they're due to have a procedure done, or they've had a procedure done, or their mom's had a procedure done, call us, 692-2721.
Ah, very good.
My name's Judy. I'll be glad. If I can't talk to you right then, I'll call you back.
Right.
Somebody will call you back and talk to you.
Yeah.
We want to take care of the community. We want to keep our community healthy.
Yep, that's what KRMC is all about.
Oh, yeah.
It really is. No, it's true. And like we talked about our rehab department here, it's keeping them healthy. And that's the important part is the follow-up afterwards. Like we talked about changing the lifestyle and to have a support system in place. That will
Absolutely.
help you because those lifestyle changes aren't easy. But obviously, if you want to stick around for a few more years, they're pretty necessary. So, we all have choices. We can decide I'm just going to keep going the way I'm going, and if I die next week, so be it. But maybe
But
you want to be around.
we rest better knowing that we've given you the choice.
Right.
You know, we want you here. We want to take care of you. We want you to get back out, stay in your home, stay healthy,
Yeah.
and
Well, we talk.
turn it into a good thing.
Yeah, well, and we talk about, on this show a lot about how being in Kingman, these are our friends and neighbors, family,
Absolutely.
That we run into at Walmart and Safeway. So that's why we are so committed to giving them excellent health care, because these are people that we care about.
You know, my husband and I walked into one of the Mexican restaurants a few weeks ago. I saw, it had to have been before the smoking ban. I saw 3 patients I'd taken care of quickly put out their cigarettes. It's like, I saw you. What are you doing? You know,
Whoops, busted.
You're only hurting yourself.
Right.
You know, please, please, please. But yeah, so that's always fun too.
That's too funny.
Or, you know, I see them in the ice cream aisle and they run off and it's like, no, it's okay. A little bit's okay. We
Yeah.
all do that.
Right. Well, Judy, it's been great having you on the show. Again, feel free to call Judy. She'll call you back if you've got
yeah.
questions. Thanks for watching. We'll see you next week.